If you are over 40, you may have been wondering about testosterone therapy. As men go through male menopause, or andropause, they can experience both physical and emotional changes that vary dramatically in severity between men. This period can last for decades, and usually occurs very gradually. It is associated with a reduction in testosterone, which is why testosterone replacement therapy is prescribed in some cases, particularly when symptoms are having a negative impact on a man's life. A man's testosterone levels reduce by around 1% per year from the age of 30. So, what is testosterone replacement therapy? Testosterone replacement therapy is designed to raise testosterone levels to help prevent symptoms associated with its deficiency. Here are some of the scary side effects of testosterone replacement therapy you must know. Raised red blood cell count, polycythemia. This could potentially increase the risk of thrombosis or a stroke due to alterations in the thickness of the blood. In certain cases, red blood cell count may become too high, leading to overly viscous blood. Overly viscous blood increases your risk of forming blood clots. Worsening of sleep apnea. Testosterone therapy may increase your odds of getting sleep apnea, or it may worsen sleep apnea if you already suffer from the disease. Sleep apnea is a serious condition that causes you to lose oxygen supply intermittently while you sleep. It shuts down your own natural production. If you want more tea, then you should realize that taking testosterone therapy will actually shut down your own natural production. Meaning if you stop taking testosterone, you will be even worse off than you were before. This can also fuel the addiction cycle and mess with your hormonal balance. Risk of heart attack. A number of studies show that testosterone therapy can increase the risk for a heart attack. This is one of the more serious risks of testosterone therapy and one of the top 5 reasons to avoid testosterone therapy. Gynecomastia. One of the more unappealing potential side effects of testosterone therapy is gynecomastia. Gynecomastia is male breast enlargement due to benign, which is non-cancerous breast tissue growth. Fluid retention in the extremities. Fluid retention may occur in the arms and legs at the beginning of therapy. It generally resolves after the first few months of treatment. Final notes. As can be seen, it is important to understand that like any prescription-based therapy, potential side effects of testosterone therapy exist. Before resorting to T therapy, talk to your doctor to find out how to increase testosterone naturally, so you can boost your own testosterone production through such measures as doing exercise and losing weight, and avoiding chemical endocrine disruptors.